Sunil Kaul, and I'm a medical doctor by profession and one of the co-founders of the ANT, which works, at grassroots level in Borderlands, part of Assam, and then some of the team that we have also works with other NGOs in the Northeast. I wish I was more active than what we do. I think when we grew up, and I think by the time I became a doctor and joined the army, I think I had not seen the rural hinterland areas, and the army gave me an exposure to that. And suddenly I started feeling very guilty that, as we all know, the poorest pay the maximum proportion of their wages as taxes. And it's on those taxes that I had studied my medicine also. And, I felt that I was working with a very elite organization, which was hardly unhealthy. And so maybe I should move out and start working with people in the villages. And that was in Arunachal Pradesh when I first. And that's how this journey started. And I started feeling more and more uncomfortable while being in the army for quite some time. And at that time, though, I didn't know something like an NGO was there. But I just thought that whatever I knew, I could teach children, and I could probably, heal some people, help heal some people. And in that, people will probably at least be able to feed me. So we had no idea that there could be salaries and there could be other things also which go around. But at that time, it was just that giving it back to the people whom we had earned our degrees from. Yeah, when we started the ANT in 2000, I had cycled the area around and had meetings with people. One was that in this area north of the highway, close to Bhutan, I think as a doctor I was appalled that in about 4 lakh population we had just 3 auxiliary nurse midwives there. And at the edges of it, there were 2 PHCs which had maybe 1 or 2 doctors and 1 odd GNM, a general nurse midwife. But that's all. Although we were supposed to have, 1 nurse at that time, we used to have, the dictum that we should have 1 nurse every 3,000 population. 80,000 of the population, at least say 1/5 of the population, had not even seen pulse polio by that time. Immunization was just at about, total immunization was about 1 or 2%. So one was the transportation was not there, education was very low, and it had become a conflict area. So development had actually slipped. So at one time when there was electricity and whatnot, in the revolution, many of these bridges were broken down, schools were burnt up, and even electricity lines were uprooted. So in that sense, we had the whole area had slipped. And we just felt that if we just continue working and just, help the people come out of the violence, it might be good. So that's what it was. I had worked for a short while in the army. I used to spend my time in the vacations, and we had long vacations. So I used to spend it with an NGO in Rajasthan. And at least from there, though, everything cannot be replicated. Funnily, I realized after 2-3 years that the most important issue there was water, and here too was water. There was a paucity of it, and here there was an excess of it in many seasons. But besides that, the communities were different, their demands were different, their aspirations were different. So obviously things could not, but at least I had learned there what not to do. So I was very clear on, ethics being very central to management. And so in one sense, constantly talking to people, understanding from them, taking them in the journey along was a very, very important comment. So maybe we were slower than what we would have done in other parts of India. And we didn't know, practically my wife and myself, when we were co-founders, we knew just one person in that entire area when we joined. So it was important for us to go slow and learn. And I think the caravan kept building as we went. Actually, when we called ourselves the ANT, we were also sure that we didn't want it to be a giant or an elephant, right? We thought we'll work small and we'll also gradually help other small organizations also to develop. But as things have evolved over a period of time, I think the small will perish, the small organizations will perish, because the documentation requirements of both the government and the funding organizations take away a lot of time only in the English documentation. So, whereas we were wanting to work with the local people, with the education standards being so low, we willy-nilly, I won't say had people from outside the Northeast, but definitely from the cities and whatnot, much more than what we really wanted. And over a period of time, I realized that the pleasure of working for the senior leadership has gone down because we hardly get time to interact with the people, right? You're constantly stuck with filing one report or, answering questions and, getting the numbers right and whatnot. And that sometimes hurts. So in one sense, we also realize that unless we grew, and then I think universally all over India, the higher salaries have increased a lot compared to the lower wages. Two is that the aspirations during my time when I was growing up, it was very common to see many of my family members, extended family, not having a toilet. And we had, we were quite used to taking a bath in the open and all. The newer generation of qualified people would find it absolutely reprehensible to try and do that. So getting people who are qualified from the cities to work with us, I think required, a higher scale so that they can work over a larger period of, larger expanse of geography also. And so now today, I think there's a kind of a back pressure that if you really want to work with money and you want to work professionally with good thoughts and, people who have seen the world, then one has to be big. Yeah. And so we are on the way to be big. We already have about 250 people. It gets unmanageable sometimes, but I think we'll get there as we are. I think we've been fortunate. One was that, because we had only once a month camp to start with. So that was a doable thing. Some doctor coming from Guwahati was doing it. And he was being paid by another organization. And so we started in right earnest. But after some time, we realized that, every time there was a bomb blast in the local area, he would not come that day because his family would not allow him to travel. And so we've got a collection of patients, and now what do we do with them? It became difficult. So gradually we said, no, we'll have to set up something of our own. And there we managed to get a doctor who had worked in the the LGB Institute in Tezpur for 15-17 years. Though he was an MBBS, but his knowledge on psychiatry was quite good. So we started using him. But then we were also scared that he might get posted out. So I started as a doctor. I said, I didn't know much of psychiatry, but I said, okay, I'll start sitting into these clinics. And then gradually I also learned. But by 2013, I think we were fortunate to get Dr. Mintu. And it's been a great journey with him because he's one of the most low-cost, humble doctors who comes every weekend. And ever since 2013, he has been coming with practically hardly any weekend which he has missed. And he does these 8 camps every month for us on every weekend. Yeah, I think if you look at, I find it a big threat also because what if something, he cannot come, then what happens? We haven't been able to motivate many people. Though sometimes the government people come, they also want to get more exposure because they themselves hardly attract any psychiatric patients. But eventually within once or twice, after that they don't come for whatever reasons. So, it's not been, I don't think that's very promising, but I think some days a month, I'm hoping that once I found a person like Mintu, he'll find somebody else and the journey will continue. Yes, because we feel that, controlling everything from very far will become like the government. So, having passionate NGOs nearby, it's good to see that, they have the social capital in that area. And we just partner with them, giving them basically maybe 3 months worth of revolving capital for the medicines, and maybe a few tablets because everything is now digital for us to have good records where we can also supervise and see that the medicines which are being given are rational and, supported by WHO formulations.